welcome everybody. We'll just get started. A few more minutes and people will keep coming in, but at the start we should, it's 4 minutes past the hour now, so we should really get going. So I'd like to welcome you all and thank you for coming to this webinar. We're going to be hearing from the experience in Cambodia today. And so I want to thank everybody for volunteering to share this experience. This started when one of our fellows, fellowship ambassadors actually, Nilüfer Rachmanova, had asked us if it would be possible to share the experience of Cambodia with COVID-19, as it has been a very good success story there so far, fingers crossed. So we have some excellent speakers here to share that with you. And just to give you a little bit of background, so from January to October this year, Cambodia had only 283 coronavirus cases, and 70% of those were from people traveling from outside of the country. The rest could be linked to those cases, and even as sporadic cases continued to be detected in travellers returning at the border, Cambodia's rapid and whole of government approach, that is test, isolate, trace, quarantine and care, has kept the numbers low. So very important to hear from them. I'd love to hand over now to Dr. Nilüfer. Nilüfer is going to field the questions at the end as well. So if anybody thinks of any questions during the course of this webinar, I just welcome you to put them into the Q&A box, which is at the bottom of your screen. If you click on that, you'll be able to enter in your question and we'll try to get as many as possible at the end. And another note as well, that this will be recorded. It'll be edited very slightly just by myself to make it all clean and tidy. And then anybody who registers for this will receive a copy of the recording afterwards. Also, just to note that Nilüfer and team are happy to share their presentation afterwards in PDF format. So you'll receive that by email as well. So thank you very much again. Enjoy, and I'll hand over to Nilüfer now. Thank you.
Catriona, thank you very much, and good morning, good afternoon, the EHQA fellows and everybody else who is joining the webinar. It is such an unprecedented times with COVID extension to virtually every part of the world, and we all see a great variability in severity with US, Latin America, parts of Europe that have the largest extending epidemic, but at the same time, some countries in Southeast Asia and Cambodia, including, escaped a surge for now, and it hasn't been easy to pivot the system for pandemic response. And you know, since the beginning of the pandemic, I've been very avid following the COVID-19 resource page of the ISQua, and I've been seeing that multiple countries are sharing their experience: UK, Ireland, Pakistan, India, and I thought that it would be good also to bring the experience of the Cambodia, and for that it's really my pleasure to invite Ministry of Health representatives. Today we have two people, the Director General, His Excellency Dr. Cheng, and also Dr. Sovann, who is the Cambodian CDC Director. And the first part of our webinar, they will present their story of macro level interventions, the Royal Government of Cambodia experience of COVID-19, the epidemiology, what were successful factors, what were the best practices and lessons learned. And I am, in addition being an EHQA fellow, I also lead a USAID-funded project. It's called Enhanced Quality of Healthcare Activity, and it focuses on quality improvement. So we were also involved in the COVID-19 response, and I would like to share with Dr. Premprey, who is the Deputy Chief of Party of this project, about how our quality improvement program was able to adapt and contribute in this COVID-19 response. And I will share my personal reflections of the working and adapting this effort. And then we will open the floor for questions. So should we go ahead with Dr. Sovann?
Thank you. First of all, may I pay my respect to my Director General, Dr. Cheng, and then saying for our colleagues that give the opportunity to Cambodian to present the experience of the COVID response experience. And my presentation is I present on behalf of all of our team from the government as whole and with partners and all that we work as the team work. So I will present my presentation. You will see that there will be a presentation from me, Dr. Sovann, and on behalf of my DG and Dr. Premprey and Dr. Nova as the moderator of this presentation. So my presentation outline will be the epidemiology of COVID-19 in Cambodia and the royal government of Cambodia response. And then there will be presented by Dr. Premprey about support from the USAID EHQA that contribute on time during the that the Cambodian need the support on time and a very quick support to us. And then there will be a reflection of question and answer. So our update is 6 November 2020. So our first detection of the COVID-19 is on January 27 at the same time as in Vietnam and in Thailand that we have a fly from Wuhan, China. He is a 60 years old man that come to Cambodia as a tourist, and then we found him positive in one popular tourist area. And we managed at that time. So up to now, we have 191,000 tested. It's about 11,000 per 1 million of Cambodian people. And so far, we found 292 cases, 283 recover, and currently active. On force, actually, this data is on force. Actually, we now left only 6 more as the active, and we have 0 death in Cambodia. So all cases in 11 April, we have 170 have been imported or linked with the direct to importation from April. So you will see that our action response is early detection, early isolation, early treatment, early investigation, and potential conduct the contact tracing and management all of the contacts. And currently and in the future, and we are prepared effort are being to ramp up so that the healthcare system can respond should there be a surge in cases, if there is any local transmission in the future, because we still keep our mind that the risk of the local transmission still very high because of neighboring and our many countries in the world still have the outbreak of COVID-19. So you will see that we have the 2 curves that at the early of January, we found a case. And after that, we have an imported case. And then there is some kind of local transmission at the beginning because of we have our cases come from, they have the Muslim ceremony and come back, and then there is some infected, and then there's local transmission. At the same time also, we have the tourist friends that come to Cambodia, and then more than 30 cases found that they visit Cambodia. After this case happened, the government implement very strict on the non-pharmaceutical intervention, such as close the school, close the entertainment, casino, and other not necessary events such as I not mean necessarily like New Year's. We also we delay our New Year's our national ceremony. So that, but we are not locked down our country. We still open, business still ongoing, but just we implement about social distancing and physical distancing. So after that, after we close down, we do not find any local transmission anymore. And you will see that the second curve is all about imported case from abroad, including our Cambodian people return back to home, and also our international passengers come back. And after that, because we increased the number, so we closed some airline that travel from the high-risk country. So that you will see that we do not have much at the third curve. We do not have much. We have only a very small number because of the ban of some flight from high-risk country, and also all the passengers require have the 72 hours negative of COVID-19. So that's why our case imported small and smaller. This just would like to show that to monitor the local transmission, we still implement our ILI surveillance, influenza like, we use the data, the sample from ILI since November 2019 to test until today, but we do not find any positive in our influenza-like illness surveillance for test for COVID. And at the same time also, we return back to test again all of our SARI samples, and we do not find any positive also in SARI sample that implement in Cambodia. So for the stage assessment, we still the stage 1, most are the imported case, but we need to prepare for the local community transmission. So we would like to share that in Cambodia, we use the multi-source surveillance. We are not depend only one surveillance. We use many of the surveillance to early detection of the suspected case and the case of COVID, such as we use ILI surveillance, we use syndromic surveillance, we call Communicable. We use the hotspot wherever that we consider that the high risk area, we need to collect all samples in that location. And also any suspected that report also we collect sample, and also we routinely test our health worker also. And one important one is about our event-based surveillance. We use our 115 hotline system. Our 115 hotline system is the digital system. It means that when you call to 115, it will forward system to the 23 mobile phone. That it will all the 23 of the mobile phone will ring, and during the peak time per day, we have called to 115 about 10,000 per day call for report and ask for further information or health education. And for laboratory, as I mentioned earlier about LI and SARI, and also we very strict of the border screening. For the land border, we screening almost, I think almost 200,000 now that screen, and then in the airline, every passenger come to Cambodia have to test for the COVID-19 on the 0. We consider 0 days mean that when they arrive to Cambodia. And all of the data we are centralized in the Ministry of Health, and then the CDC department is the place that we keep all the data centralized. And our data is from not just from our own national laboratory, but also from different ministry also come to integrate into our national data management. This just show the process of our screening. You know, whenever the flight come in, they need to fill our quarantine form, high declaration form, and then we screen for the patient have symptom or not, and then if so symptom, we will isolate them as soon as possible by ambulance, and if no symptom, we need to screen them by collect sample on the 0 day, and then we will test again on the 13 days. And in one flight, if no anyone positive, we could release them for the resident or home quarantine, voluntary quarantine, but under the monitor of our local authority from national up to village level, and asked to test again on day 13. This is one of our contact tracing. We conduct the contact tracing very seriously, and then also we divide our level of the contact also by 3 level: high risk, medium risk, and low risk. And we will respond according to our definition of each of the risk. One luckily also that we have the integrate of a Cambodia master plan for COVID-19, which that we involve from our government, whole government, and also from international partner like WHO, USAID, USCDC, World Bank, ADB. We integrate in one master plan that we follow the WHO recommendation of 9 area. I will not go detail. I think everybody know about this master plan. So the question is how risk of Cambodia of local community local transmission or large we still consider as the risk. So that's why we need to still early detection, early response. At the same time, also we prepare for our health care facility, prepare for the future in case that there is the local transmission happen. And we prepare also for the mass of contact tracing and containment. If any village or commune that happen in local transmission, we will join hand by hand with different sector, with local authority to respond together. I just would like to show you briefly about what are the success of from this response. The first one is we have the strong leadership using the whole government, whole society response. And our leader is the chair of the response, and then he monitor day by day, and including our minister also as the vice chair, that we coordinate with all the sector work together to respond. And we have the concrete activity and concrete plan together. The most important one is very important is our international solidarity. So we work as the very close cooperation and with the transparency, and we work together, teamwork together day by day, and we share all our data together. If anything happen, we work together and to respond together. The most important one, we have the funding, resource, equipment, and supply in place that that could have a proper resource to respond to this COVID, to cover this 9 technical area. So the best practice and lesson learned, actually since SARS outbreak in 2003, Cambodia after SARS, and then we have avian influenza, and then we have the foot and mouth disease, and then we have the pandemic influenza 2009. So we prepare our public health, functional public health system in place So that's why we have good of multi-source surveillance in Cambodia for the early detection and early response. And also we invest to our human resource. We train in advance our 3,000 rapid response team across the country to conduct case investigation and contact tracing. Another strong one, also we reboost testing strategy and contact tracing system in place. We have the broad testing strategy implemented nationwide. We testing all suspect and case meeting the case definition. Active surveillance for the pneumonia cases in hospital. It means that every patient that admitted to hospital with the pneumonia, we test them all for the COVID-19. And we test at the port of entry at day 0 and day 13 of 14 days of quarantine. We test all our LI and SARI samples. Even we restore respective tests since November 2009. And also we conduct the hotspot surveillance to target the high-risk area if we found that meet with our criteria considered as the hotspot area. The same time also we have good of the risk communication and community engagement. We have the timely message dissemination through TV, radio, social media, regular press release, press conference, and media briefing. Actually, at the beginning of outbreak, we have the press release every day, and also we conduct the press conference head by our minister to the public every Monday, 9 o'clock in the morning. During that, we have the case at the beginning. And we targeted communication material developed for the at-risk group, including migrant and garment factory worker. And more than 100 TV spots developed to disseminate and educate our public, including our minority language. So for the laboratory, luckily in Cambodia, we have Pasteur Institute Cambodia that recognized by WHO that is the one of designated institute as one of the 17 global COVID-19 reference laboratory. This Pasteur Institute that could train and build capacity our national lab. Up to now, we have 3 lab more that could test this one. And the current capacity, we could test up to 2,000 tests per day, 2,000 to 3,000 per day now. But we prepare for tests at least 10,000 tests per day in the future to prepare for if any local transmission, community transmission. And we will expand more laboratory at the province for more sites in the future by using gene expert instrument and molecular labs. So for the future and culture of innovation, what we learn is that we must invest in preparedness today, so we will not have regret tomorrow. Preparedness is the best way to minimize health, social, and economic impact. COVID-19 will not be the last pandemic. We must transform the health system for the future. A strong health system is the precondition to managing COVID-19 and for any future health emergency. We consider health emergency here is not just communicable disease. We also respond to any non-communicable disease, including food poisoning, environment impact, water poisoning in our system. I think the number 3, everybody know we must create a new normal. COVID-19 will be with us for months and years, and our government, our people know about this one through our risk communication. So we all must adapt to a new way of living, working, and interacting with each other to minimize high risk allowing for economic activities. So like I say again, even we close some of our non like internment school, but we are not locked down even during that we have local transmission, and our business still running. And because of at August and September, we do not have imported case much, and we do not have the local transmission. The government now open all of the internment and school already, but all of them need to implement strictly with the Ministry of Health measure and advice. So may I turn over to my colleague, Dr. Premprey, to continue the next presentation, please.
Thank you very much, Dr. Sovann. Yeah. Let me share this. Thank you very much, Dr. Sovann and SNC Hong Cheng. Thank you, Nilofa, for opportunity to present. So I just would like to present the contribution from USAID enhancing quality healthcare activity to support Ministry of Health to respond to COVID. So USAID have made very crucial decision in terms of mobilizing funding to support to MOA to respond to COVID. USAID decision was made before the second case of COVID in Cambodia were identified in early March. I think this is very crucial decision. So with the support from USAID, we were able to contribute to Ministry of Health. So I just would like to summarize about the goal of EHQA project is try to improve quality of public and private health services by focusing on pre-week education, ongoing quality improvement at healthcare facility at both public and private facility, and to support the country to establish healthcare accreditation system. So with the support from USAID, we were able to quickly respond to urgent requests from Ministry of Health to supply the VTM, viral transport media, the soup and sport for storing and transporting specimen for testing. So we worked together with FHI regional office in Bangkok. We were able to supply VTM within less than 10 days in mid-March when the VTM in the country was running very low. It was very crucial, and we are so proud to be a part of that to respond to Ministry of Health Agency Hong Cheng request on that. And in addition to VTM, we also were able to support a computer to Cambodian CDC Department and the National Institute of Public Health for conducting contact tracing and for managing lab information system. So that's very significant support that we contribute to the national response to COVID in Cambodia. So when the world has been changed, as Dr. Sovann mentioned, for a new normal life, we has been providing support to all provincial, 25 provincial hospital and selected district hospital with the conferencing equipment that can allow them to meet, to discuss and to learn online in a very timely manner. So this is very useful that can help them to reduce costs in traveling to attend the training time as well. So this is very beneficial for provincial hospital, district hospital who have the conference equipment, want to learn about updates of COVID and to share information from among each other, as well as to discuss about case management. So the equipment has not been used just not only for COVID, but also for managing other diseases at their regional hospital as well. So With the quick response from Ministry of Health in establishing different working group to coordinate, as Dr. Sovann mentioned, under the leadership of Prime Minister and Minister of Health, we also provide, the project has been providing technical support to some technical working group of Ministry of Health as well. With our strength in terms of working at sub-national level, we are able to support 6 provinces in our Takai province on 3 main components. First one, to strengthen the provincial mechanism to respond to COVID. We are being a part of the committee. We support the training for rapid response team at provincial level. As Dr. Sovann mentioned, rapid response team has been established since the past to respond to SARS and other infectious disease as well. Second part is we try to support a hospital at provincial level to be ready to provide care and treatment if to COVID patient in case community transmission happen. In addition to that, we also support building capacity of healthcare provider to on infection prevention control, on clinical management of COVID, so that they can continue providing service while by implementing appropriate preventive measure for COVID. In community, we also work with community to raise awareness and to promote intervention measurement, as well as to strengthen community system to be ready to provide community or home care and focusing on referral to healthcare facility in case local transmission is occurred. We also have the dashboard to monitor what we has been implementing on COVID to support to Ministry of Health on national response. That's a brief presentation from me about our USAID EHQA contribution to the national response of COVID in Cambodia. I would like to hand over to Dr. Niloufar Rakonova, who is the Chief of Party. Thank you very
much. Okay, so thank you very much, Dr. Lee Sovann, and thank you, Dr. Premprey. You heard from Dr. Lee Sovann what was the response at national level, and I already was reading some of the comments where people were saying that it's pretty swift and impressive. And you also heard from Dr. Premprey the story of how Quality Improvement Project was able to pivot its effort, expanded its scope, and adapted continually. I would like also to in addition to what Dr. Lee Sovann mentioned about the success factors, I would like to reflect from our perspective on positive factors. I had a chance to experience COVID-19 situation environment both in Cambodia and the United States. When the first case was tested here and identified here in Cambodia in January 27th, within days and a couple of weeks already, there was a signs that government is coming up with the measures, technical working groups created, the master plan developed, risk communication started, reaching out to the population, and the enforcement of the non-pharmaceutical measures. Late March, I traveled to the United States, and it was very interesting to see a difference between the enforcement of the measures in the United States at the end of March, when there were so many cases already and surge in New York. There was still a lot of confusion and unclarity about many aspects of the COVID-19. I also came back in late August to Cambodia, and I really struggled to identify the testing sites that would provide the PCR test results within 72 hours. That was the requirement for the Cambodia to accept. And in the US, it took several weeks to find the testing site. When I arrived to Cambodia, I was tested with a PCR in airport, just like Dr. Lee Sovann mentioned, and I received the results within 24 hours. So it's really impressive. And I think that the lesson that I realized is that it's not so much the resources that country has that will reflect its response, but it's really how the country is able to organize the existing resources. Dr. Sovann also mentioned about the incredible solidarity, and I would like to mention WHO. They played really critical role in coordinating multiple partners. There are a lot of partners here in Cambodia that are supporting Ministry of Health and other parts of the government, and they were all willing to do something on COVID-19. And in some ways, that clarity that existed from the government level and the coordination from WHO helped projects like us, quality improvement projects, to find the niche and provide a response. And you heard from Dr. Premprey that this quality improvement project, we were able to support at many levels, at the national level, the provincial level, facility and community. And many of you are quality improvement fellows like myself. And I just wanted to say that without having a prior experience in disease outbreaks and surveillance, I'm actually amazed that we were able to try to be responsive as possible to the emerging needs at all levels. The first and most urgent need by the Ministry of Health on VTM and delivery on record-breaking time, even before the second case was diagnosed. And then the provincial health departments whose perspectives we continuously sought throughout, and building confidence of both public and private health providers. And I would like to believe that the quality improvement and health systems thinking helped to pivot these efforts and adapt continually. And I used continuously the ISQua COVID resources. They were very helpful to inform the design of our COVID response. I also would like to say that in addition, of course, these measures, they played a really critical role. We also know that overall the Western Pacific region continues to show the lowest cumulative cases, accounting for less than 2% of global cases and less than 1.5% of all deaths. And it's really actually interesting phenomenon that Cambodia spared from SARS-CoV epidemic, like some of the neighboring countries, not all countries in Southeast Asia. And there can be different reasons for that. We can talk about this, perhaps low population density, limited public transportation, a young population, but that is very interesting phenomenon that is worth exploring. I also would like to take a moment to talk about some challenges that we experience on our program side. I think that at the beginning, like probably many countries here as well, you have experienced the same anxiety about being infected with COVID-19, both among the healthcare providers and among the population. And it's a very interesting cultural aspect. I put the photo of the scarecrows that you could see very often in remote areas in Cambodia. It was their way of averting the epidemic. I also would like to comment on the extraordinary pace that was required, especially in the first 2-3 months after the epidemic in March, April, May, where we had to make very quick decision making and very quick acting. And I think that it put really a lot of strain, at least on our program stuff, and I think it was very difficult to sustain with that quick pace for a long time. It was great to also engage the private sector. Here in Cambodia, private sector is very prolific, and patients were using the private sector, especially the pharmacists as well. So it was interesting to engage them in that. Sharing the knowledge and building a confidence. And also now, it's interesting to see what are the challenges are different now. Due to the absence of the community transmission, we see that there is a complacency and the decreased somewhat vigilance to maintain screening and triage. So we have to ensure that they go back to the same urgency that they had during the first months of the pandemic. And we also see that there is a need for capacity building for COVID-19 case management, although people are trained and retrained, but because there are no cases, it's very hard for them to retain the necessary knowledge. And of course, in October here, there was a very heavy rain that caused the flooding, and that adds an additional strain on the healthcare system. Next slide, please, Dr. Premprey. I think that where we are right now is we are thinking together with the Ministry of Health, with the partner, on how can we position towards these future challenges. And like Dr. Sovann mentioned, how can we adjust ourselves to the new reality? From our programmatic side, as Dr. Premprey mentioned, we have been able to set up the video conferencing equipment among the hospitals. By the way, this idea was inspired by some of the examples I see from the countries that were shared on the ISQua platform, the telemedicine and telehealth. And what's actually amazing about Cambodia is that the virtual communication is very popular. Even before pandemic, it was very popular. Many people, they prefer to exchange information through Telegram or Facebook. And when the COVID-19 struck, people embraced very quickly and used these methods of communication for COVID-19 exchange. Lots of COVID-19 virtual groups were created, and it was really great to keep up to date each other and keep that transparency that Dr. Sovann mentioned. But at the same time, what we are realizing now is that to make that telehealth work very well, we have to be very, we have to really think through, design and sustain regular and facilitated virtual training and coaching, and that requires a significant effort. Strengthening COVID-19 preparedness while maintaining quality of essential services like TB, HIV, maternal and child health. I'm sure that many of the countries are in the similar situation, and this is where we are right now. We're trying to figure this out. What should be the effective interventions that will help healthcare providers to follow the triage IPC requirements with the consideration of the COVID-19? How can we support them to in this behavior? And and of course continue promoting the essential barrier measures like physical distancing, hand hygiene, wearing masks, and space ventilation. I also would like to mention that Cambodia is very proactive on planning the COVID-19 vaccine to priority groups, and we hope that we will be able to support Cambodia in that aspect as well. So I would like to finish with the words that what is natural is the microbe, and all the rest, health, integrity, and purity, discipline, is a product of the human will, of a vigilance that must never falter, like it was written in the Camus novel, The Plague. And I also would like to finish with the words, let's fight together. These were the words that were always put by our colleague in Thailand when we worked together on the procurement of the viral transport media. And it gives really a hope to us that we can fight this virus together, and we are constantly learning from each other, openly sharing our best practices and lessons learned. And with that, I am wrapping up our talk, our speech, and I'm going to the question and answer session. First of all, I would like to say that there are a lot of participants from multiple countries. I was able to trace that there are people from Nigeria, Brazil, Bangladesh, Indonesia, and Cambodia. Many people are asking to share the slides, of course. Yes, like Catriona mentioned, we'll be very happy to share them after the session. And I see the questions. So the first question is from Tafik. He is saying, I am curious about the contact tracing capacity of Cambodia. Are there separate cadre of contact tracers under any government health agency? Or did Cambodia employ volunteers? How was it arranged and managed? Was it technology driven with a mobile app, or was it done more in the traditional format? I think this is a perfect question for Dr. Sovann. Dr. Sovann, would you be so kind to answer this question?
Yes, thank for the question. As I mentioned, we have our rapid response team trained 3,000 across the country that they could do the investigation and contact tracing and make sure that whenever we quarantine, make sure that they really quarantine. And also, we are not just work with our health worker, our own. We work with our local authorities, such as police, community leader, the head of village, and also we work with our what we call the national Cambodia national security investigation. This is crucial, you know, because some of the people, they really don't respect us, but we need to sometimes have to use force. So sorry to say like this, but actually is real. You know, we have active participate from our police investigation also after that they manage for the national security that assist us, and we work very effectively together on. And we, of course, we have the system to tracking. You know, we know that we use the mobile number tracking. We work very close with the telecommunication, and then you could not lie us. You know, we know that if you are not really follow the quarantine, we will know that on that day, on those days you go there. We know that you go there, and then they could not lie us anymore. And then they have to strictly follow the tracking and this information. Sometimes actually I got some not happy so that this is privacy, but no choice. The privacy and the national security, we have to have a choice, because we want to. Our priority is national security and make sure that we do not have the community transmission. So that we need to work closely together, and this is our contact tracing. And also when we, as you know, when we do the hotspot surveillance also, we need to work with the private sector, the owner of the building, of the condo, of the hotel. And then we need also participate from our police and military army also to assist us to inform to the owner, and then they actively participate with our investigator and contact tracing. Thank you. Over to you.
Thank you, Dr. Sovann. Truly whole of government approach. A very interesting question from Flavia. Do you think that national culture has influenced the success of social isolation in addition to partnership with a health organization? Dr. Premprey and Laurent, perhaps you can answer to that question.
Okay.
Oh, sorry, Nilüfer, we were mute. So I start again. Yeah. So
Okay,
that's
go ahead.
the question we were asking ourselves from the beginning: why we have so little secondary case in the country, similar to a neighborhood country like Laos, Vietnam, or Thailand. And there might be many reasons for that. I'm not sure we have the answer at the moment. But first, it's important to consider that even if we might expect that the virus was circulating in the country a few months ago, when we didn't know yet the virus was in country, like it's observed in some in France or Italy. And in fact, all ILI and SARI tests that was shown by Dr. Sovann were retrospectively tested, and all were negative. So we have no argument to say that the virus was circulating before, and this is an important observation in the country. So why with all these imported cases, we didn't find much secondary case? And Dr. Sovann mentioned the strength of the contact tracing approach in the country, and clearly we didn't find many secondary cases from all these positives identified in country. So why is this not happening? It might be factors due to the virus, because there's lower contagiousness due to the climate, to the temperature, humidity, solar exposition, things like this. But frankly, there are different countries where we observe this kind of epidemic, so it's not a good explanation. Then it can be due to the population, and you refer to the question. Cambodia is a very rural country. People are living outside. They have a low population density in the province, and there are limited public transportation. We don't have a metro or tramway here, so people are outside. It's a young population. 65% of the population is below 25 years old. And we might also think that the population has some cross immunity against coronavirus, because we might be seeing coronavirus in the region from China. Or it could be as well that the population has a stronger natural response against the virus because of genetically or acquired immunity that is stronger. So that's just a hypothesis. But of course, last explanation is that non-pharmaceutical intervention taken by the government and the Ministry of Health were done very efficiently and early in the course of the epidemic, and that's really contribute to the containment of the infections, and that's a good lesson learned for other countries. But frankly speaking, I think we still await seroprevalence studies to see how much of the virus was circulating in the population or not. And this is some kind of information that will be very interesting to understand better about the transmission in Cambodia.
Thank you very much, Laurent. There are lots of comments that are praising the effort of Cambodia and useful experience. They're saying we have a lot to learn from the strong leadership and organization to fight COVID-19 in Cambodia. Thanks from Bulgaria. The question from Peter Lachman, who is the CEO of ISQua: how can the learning be spread regionally and more internationally after the webinar? Peter, that was exactly the reason why we brought this experience to ISQua. This is our first international webinar, and we are happy to discuss with Catriona perhaps on what more we can do. But thank you very much for acknowledging that experience. I think that there is also a question about rapid response teams and tracing, and what training and skills did the tracers have? What is the process for close contacts? And I think that Dr. Sovann already answered for that. And another question was viral load versus severity noted across those infected. what, who would like to answer? Dr. Sovann or Laurent, about the viral load versus severity noted across those infected?
No. Sorry, Nilüfer, can you phrase the question again? We didn't get it.
The question is, what was the viral load versus severity noted across those that were infected with COVID-19?
I mean, the fact is we really have only one severe case. Most of the cases were asymptomatic or very or mild. Only one case was severe and needed some oxygen, but I don't know about the correlation with the viral load. As far as I know from Pasteur Institute, viral load they were observing as a type of viral load we observe and we have been described in the literature. Nothing special. We didn't have a lower viral load level compared to other studies or other countries. So I think nothing special behind this. So the important thing is that we had a lot of asymptomatic and mild cases, but this can be explained because of the systematic screening that is being done. And then of course we detect imported cases that might not have symptoms, but that's the strength of the systematic screening to detect cases even when they are asymptomatic. So I think that's something important to consider, because it's an important factor to detect asymptomatic cases for this disease.
Thank you, Laurent.
Maybe Dr. Sovann want to add on the viral loads. Dr. Sovann, do you have anything to add on the viral load and severe and symptomatic cases in Cambodia?
I do not have any comment on this one. Yeah. I think should be the lab expert and to talk about this one.
Dr. Sovann, lots of questions about contact tracing, so I will be averting them to you. Any key challenges experienced with contact tracing at community level? For example, willingness or by contact to be screened. Did you see any resistance?
Yes, thanks for the question. As I mentioned earlier already, that because of the resistance from the owner of the residence, and of the case, so that's why we use our police and military army, and also our national investigator, security investigator, and also we use our Ministry of Telecommunication to track them, so that you could not ally us. Sometimes they said, no, I don't know, I don't go anywhere, But when we track them, we know very well you could not ally us. So we work very closely with all this area. Yeah.
Oh, thank you very much. Yeah, thank you, Dr. Sovann. There are lots of good comments from people, and I think that we came to the end of the session, but I just would like very quickly share with you. Thank you for the clear explanation of how to improve the situation. Thanks for marvelous and valuable presentation. Peter is mentioning, thank you for a presentation. Consider writing up for the international journal, Society for Quality, ISQua journal. Thank you, Peter. And also the key lesson for other countries is Cambodia's prior investment in public health emergency response. And Dr. Sovann mentioned that already. So that's great. I think that's been a very good session, and I would like to thank His Excellency Dr. Cheng to be here with us. He led a lot of part of the Ministry of Health effort. Dr. Sovann, thank you for sharing the presentation. Laurent, he is our FHI 360 advisor, and Dr. Premprey, thanks very much. And thank you, Catriona, for creating this opportunity, and all participants for your wonderful comments and questions.